Hey, welcome to This Week in Pharmacy. Today is January 31st, 2025. My name is Todd Urey, founder of the Pharmacy Podcast Network, and I'm glad you're here. How has your week been? Can somebody just slow it down? Because I keep saying this. 2024 went by like a flash, so fast. And now we're in February. Like, what the heck? It just goes too fast. Hey, we've been busy. I want to give a shout out to the Pharmacy 50 most influential leaders in our profession. We had the awards ceremony, released this on January 29th this week. What a celebration. What a wonderful time. We had people come into the studios here in Brownsville, Pennsylvania, which is south of Pittsburgh. We had our number one award winner, Anthony Menini, pharmacy owner. He has a cannabis dispensary. He's involved in the state pharmacies or organizations in his buying group. Shout out to CPA, Compliant Pharmacy Alliance. What a champion. And we celebrated him. He made the number one most voted for influencer of our pharmacy profession. But I want you to take a look. Just go to pharmacy, listen to me, pharmacy50.us. Once again, that's pharmacy50.us, and take a look. And if you see anyone you know, please reach out to them and congratulate them, because this is special. We have to raise each other up and celebrate each other's accomplishments and challenge each other. If you are a Pharmacy 50 alumni, if you won in 2021, 22, 23, you should be networking with fellow 50 most influential pharmacy people, because you guys are the best of the best. And it's the peers that voted for you to say that. And there's going to be some partnerships that are going to blossom. And then there's others that you'll at least know each other through LinkedIn, and you'll be able to cultivate friendships. But regardless, what an amazing time. I just want to thank RX Insider. Greg, thank you for coming into Pittsburgh and spending time with us all the way from Rhode Island, from the RX Insider headquarters. And I also want to say thank you to IPC, and Independent Pharmacy Cooperative, for your support. You guys are just a great partner in helping us put amazing content out, and it means a lot to me. All right, we have a big day. We are going to get right into, you know it, TWIRx news. TWIRx news. TWIRx news. Is that creepy? I think it kind of sounded creepy. Hey, the first news is selfish news. I would like to make an announcement that the parent company of the Pharmacy Podcast Network was formed at the end of the month, and we just released our national press release that our XPR is now our parent company. We have 3 divisions. Our XPR will have a podcast network, obviously. Thank you so much, Pharmacy Podcast Network, for joining the team. We will have a public relations division that handles our clients' press releases, campaigns around press and connections with reporters, even local press. So if you're an independent community pharmacy out there listening to this show, you now have your own public relations company embedded into the profession of pharmacy, the first of its kind. Take a look, rxpr.net. And once again, this is to empower our profession on so many different levels. And then our third division is going to be our conference division. And that is, if you have a conference that you're going to, you're an organization that is building your conference environment, we want to help blow that opportunity up and do some interviews and help you market your presence there, bringing people together, bringing multiple vendors and partners together to do more. And then, like I said, Together RX is the name of the game. And look that up, #together, and then put the X at the end, and you'll find a bunch of organizations finally understanding what this all means and being able to work together to change the game. One of those organizations changing the game is YARAL Pharma. YARAL Pharma has been a partner of the Pharmacy Podcast Network now for quite some time. They've been one of our clients. They're a wonderful organization that is focused on levothyroxine and other generic medications. And we are excited that they have extended their relationship with the Pharmacy Podcast Network to continue to develop good programming that helps to educate our pharmacists, our pharmacy owners out there. A shout out to the pain guy. Mark Garofoli has been part of the YARAL programming. He was at the NCPA meeting in 2024, and it was such a fun time hanging out with him. But just want to let you know, look them up, yaralpharma.com, YARAL spelled Y-A-R-A-L, yaralpharma.com. And they will help you build the necessary business and knowledge that you need to support pain management, topical, and their ingestible, their tablet. So reach out to them. All right. First up on the news is the Atrium X conference is happening on February 27th through March 1st. We're excited to be a part of this. We are the official press partner. We're so excited to be going to this conference. Not sure if you've ever heard of this. Once again, this is February 27th. We are the Atrium X official media partner. We're very proud of this relationship. Shout out to Nicolette Matthey. Dr. Matthey is launching this. We have some key exhibitors that we're so proud to be partnering with. A shout out to RxSafe, the Icon RxSafe system, delivering innovative healthcare solutions and technology and dispensing and eye-seeing robotics that can tell you what the tablet is and a whole bunch of other things. But I want you to take a look at this. Go to atrium24.io. Once again, that's atrium24.io, and go to the Atrium Conference section. You see it on your screen right now. Once again, Atrium Conference. It's the conference that you create. Like I just said that. So think about that. You show up at a conference. Have you ever gone and said, boy, I wish they'd talk more about remote patient monitoring and actually how to do it, or how to make money in pharmacogenomics, or how to build my supplement business? Well, guess what? You listening right now, the pharmacy owner, get to build the content and build the discussion about what we should be talking about as a group, digging into it, getting expertise, getting great ideas shared. There's going to be some amazing people here. Shout out to IPC, who's also going, Independent Pharmacy Cooperative. So there's going to be some anchoring organizations that are going to be part of conversations. A shout out to Liberty Software, who's also going. But think about this. If there's things that you'd like to expand in your pharmacy business, this is the place to come and mash up your minds with other people to really come out with something, a conference for the first of its kind, to really make something actionable based on what you want to talk about, what you think is important. Hey, in the news, coming from Pharmacy Times, Q&A. Pharmacists play pivotal role in evolving diabetes care with new treatments. And this is written by Ashley Gallagher, one of the editors over there at Pharmacy Times. This digs into the diabetes treatment landscape, is really set up to really have a significant change in the coming years, with pharmacists playing an increasing pivotal role due to gastric inhibitory polypeptide GIP GLP-1 receptor antagonists are showing promising results in lowering blood pressure and aiding in weight loss, and could be a game changer for many patients. And it's according to Megan Smith, PharmD, clinical health coach and pharmacist at Food City Pharmacy. This is an interesting article. This is an opportunity to expand your services or your consultancy as a pharmacist who wants to build maybe a private consultancy in your community. It is happening, people. It's not something that might be happening. If you were a pharmacist, you're like, I would really like to build either a side business as a consultant, make some more money, or if you want to transition to becoming 100% entrepreneurial, the topic of GLP-1s is going to be pretty important because the long-term impact of these medications and being able to really deal with your condition, the patient's condition, they need a pharmacist involved. A shout out to you entrepreneurs out there. Reach out to me. Reach out to RxPR. We'll help you build your business. You know it. All right. Next on the list of items on news from Healthcare Finance. This can be found at healthcarefinancenews.com. The quote here, the topic is, many independent pharmacists will not stock drugs in the price negotiation program. It says CMS should bar PBMs from requiring pharmacies to participate in the programs, says association survey. Listen, this is frustrating. So the National Community Pharmacists Association, the NCPA, submitted comments to CMS and Medicaid services warning that more than 90% of independent pharmacies may decide to have or have already decided not to stock drugs in Medicare drug price negotiation program because of the potential financial loss. Like, this is madness. You can't force businesses to subscribe to something that then they're going to lose money in doing it. It's unfair. This is all part of PBM reform. Pharmacies will have to float thousands of dollars every month waiting for refunds from the manufacturers. That will cause a massive cash flow problem in an environment where thousands of pharmacies have already closed. That was a quote from Douglas Hoy, CEO of NCPA, and that is absolutely, positively correct. We cannot afford to shut down any more pharmacies anywhere, with 8,000 pharmacies being shut down over the last 4 years, because it's a danger to public health. So I'm not sure what the next moves are. It says NCPA said CMS should bar pharmacy benefit managers from requiring pharmacies to participate in the program to serve Medicare Part D patients, and said it should also give pharmacies the ability to cancel PBM contracts without cause. This is crazy. This has to happen. It has to change. The system is broken. It's all about the profits of the PBMs, the 3 big PBMs, that is, not the rockstar standalone, fiduciary-driven, transparent PBMs that are out there. A shout out to Jeff Malone of RX Preferred Benefits. He's one of those champions. Jeff Malone was a Pharmacy 50 winner, and he is an influencer because of the new models that he's presenting through his PBM. Once again, that's RX Preferred Benefits. Last up on news, before we get to our feature interview, you're not going to want to miss the feature interview. This is with 2 powerhouses putting together the pieces of the puzzle to make the digital health home a reality. The digital health home means huge amounts of profit and opportunity for pharmacies and for community pharmacies and our independents. You're not going to want to miss the feature. But before that, another Pharmacy Times article titled Pharmacy Focus, GLP-1 Medications and Pharmacist Role in Counseling Patients. This is really interesting that the diabetes care article really ties into this. And in this episode of Pharmacy Times Pharmacy Focus podcast, Donna Ryan, Dr. Donna Ryan discusses the evolution of the growing significance of glucagon-like peptide, GLP-1 medications, in managing obesity and diabetes. This is an interesting podcast. I only got halfway through it because I had to do TWIRx. TWIRx was in the works. And when TWIRx is in the works, I got to push other things aside. And but don't miss that. I'm going to have it listed in the show notes. You'll be able to follow up and read the article titled Pharmacy Focus, GLP-1 Medications and the Pharmacist's Role in Counseling Patients. I see, once again, another profit opportunity of you building programs and coaching your patients in your community to reach out to you as a diabetes expert and a medication management expert, and make a program and tie it into the dispensing of any medications that touch that. All right. I tell you what, we are moving, coming out of pharmacy and the business of pharmacy in 2024. Lots of frustration, lots of pharmacies shut down. This is a year of growth, 2025, and I want to be a part of it. So if you want to talk about business development, branding of your pharmacy, branding of your pharmacy business, organizations out there, pharma manufacturers out there, You got to get involved in the inside of pharmacy and pharmacy care. It's not just the physicians. They're the prescribers, of course, the quarterbacks, but it's the pharmacist that sees the patient 9 times more, and you should be engaging them. So before our feature, we'd like to thank Happier at Home for your partnership and your support. You're making quite a difference. And with that, we'll take a quick break. We'll be right back with our feature interview, The Digital Health Home. We'll be right back. Hey, and we're back. Hey.
This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? What if you were to learn about services and products that you could keep in-house as opposed to referring your customers out? On my podcast, Happier at Home PRN, learn from the experts who have expanded their services to increase revenue, earn out-of-pocket payments, all while increasing the quality of care in their community. Listen to our past podcasts and join us for future episodes where we focus on growing your pharmacy into a thriving business. And we're not talking about keeping your head above water. We're talking about wealth and the survival of your pharmacy.
Hey, and we're back. Hey, let's talk the digital health home for a second. And just to give you a definition around what that means as a pharmacy owner, as someone who works in a hospital system pharmacy, knowing that your patient is going from the hospital to the home, and there might be some condition that that patient has, that there should be ongoing treatment or ongoing observance through remote patient monitoring. The smart Wi-Fi home system refers to using the internet to connect multiple devices, home care monitoring, supporting health, supporting well-being, medication management, particularly obviously our seniors. But there may be some people out there who have special needs that we need to remember. Hey, the future of healthcare is going to be from the community, and AKA the community independent community pharmacy. So when I think about this concept, that is the digital health home, let's talk about the numbers for just a second. Not sure if you know this, but the smart home, which is what we're calling this healthcare market, in 2028 from 2024, they say the market's worth about $22.8 billion right now with a B. By 2028, that's going to explode to almost $62 billion of an opportunity. And you listening right now, you pharmacy owners out there are puzzle pieces to take advantage of this. And the puzzle pieces are ready. They're already there. They've been baked. They just need a aggressive pharmacy owner out there that knows that the future of pharmacy is no longer just the prescription dispensing fee. That's obviously something, but it's more. It's more care that patient is needing in their home. People don't want to go to nursing homes. There's been a champion on our team as part of the Pharmacy Podcast Network for quite some time, and I still don't remember which NCPA event that I met Debbie Marcello at, but she is a rock star. She's helped us to expand our content into a piece of the market that is growing and has to grow for the sake of the survival of our independent community pharmacies, but more important, what the community needs, and that is more home care services. Debbie Marcello, welcome back.
Hello, hello. Thank you so much. I think it may have been 2021, possibly, maybe 2022, but it was a serendipitous meeting for sure. I do remember it.
It was, and I knew it was happening. I didn't know where to look, but I knew that home care had to be an extension of the community pharmacy. And you've not only built the model, but you've expanded the model. And how many independent community pharmacies now are also Happier at Home franchises?
Well, we have 27 Happier at Home locations, and the great majority of them are pharmacy owned. So I would say we're probably at around 24 pharmacy owners.
Excellent. Yep. Excellent. Really, today's subject is we need technology to be easy. We need to be able to leverage and use it and not worry about the gaps between monitoring and data and So once again, I always look for the champions. I'm inviting Ashton Maaraba back from IPC's Digital Health Division, running the iCare Plus platform. Welcome back, Ashton. How are you?
Thanks, Todd. Always great to be back on this show. It's a riot.
All right. So this is a big number, $22 billion right now in the smart home healthcare market, jumping up 62 billion opportunities. If I'm a pharmacy owner, I'm listening to this podcast, I'm like, okay, let's put these pieces of the puzzle together, like I was saying. And I need to start with you, Ashton, because you have the heart system from the technology perspective, so that now we can move from you're being cared by your independent community pharmacy. They know what's going on. Now they have a system to be able to monitor some of the serious disease states or ongoing chronic disease states, or maybe they just came from the hospital and they need specific care. Talk to us a little bit about how iCare Plus is helping to be part of that $62 billion explosion.
Yeah, that's a huge number. It's massive, and it just shows you where we're trending as an industry and an investment community as well, where the dollars are going in healthcare. And there's a reason for that. But first and foremost, I always have to thank Todd and the Pharmacy Podcast Network for having us on. I think it's a great show, and Todd, you keep growing, and it amazes me. You're bringing great thought leaders together. You're bringing the actual people that are on the front lines, the entrepreneurs, the enterprise folks that all really get it from the ground up. So I appreciate that. And of course, being here with Debbie, it's great to meet you. And one of our partners at IPC on the vendor advantage side of our pharmacy program. The other thing too, just for the listeners, IPC Digital Health is a wholly owned subsidiary of IPC. So it is its own company, but as a subsidiary of IPC. But back to your question, Todd, I'll sum it up like this. A smarter home from the healthcare side leads to a healthier patient. A smarter home with seamless tools, healthcare tools and solutions that are turnkey, that address the need for every type of demographic user. And I'm talking about the 18-year-old to the 80-year-old, leads to a healthier patient, reduces the amount of hospital readmittance rates, reduces mortality rates, and just about everything else. It also creates the opportunity and the bridge between the home and the healthcare community that's outside of the home, but from a remote perspective. One of the things that we've done and we've accomplished as a group at IPC and with the help of our partners, like Debbie, is creating that really important bridge to what we all believe in is the number one healthcare destination in primary care and acute care today, and that's the pharmacy, and also slowly becoming the number one destination for managing and monitoring chronic conditions, patients suffering from chronic conditions through the use of remote patient monitoring technology and tools. So when you phrase it that way, Todd, in terms of iCare Plus in the home, you really have to think about what the end result is. So think of like the last mile of care. So with iCare Plus, we have two phases of our program. We have phase one, which is the iCare Plus virtual healthcare center at the store. And then we have phase two, which addresses a patient's chronic illness. That patient becomes a case in our platform. That patient goes home with a specific device, depending on their condition. And that patient begins to interact remotely with their pharmacist and additional caregivers if they're part of a collaborative practice agreement, or just the pharmacists in states where you have provider status exceptions, where the pharmacist can manage direct billing. So, it all begins with that smart home, the seamless technology, the turnkey technology that appeals to the various demographics, and the opportunity to address whether or not the medications that that patient is taking are actually working through, let's say, holistic and comprehensive medical devices that are interoperable to turnkey healthcare platforms like iCare Plus. So that's probably sums it up, and we can go a step further. But I think that's probably why you're seeing that massive investment, because at the end of the day, you're saving the healthcare industry. I think one statistic that maybe can be brought up is the amount of dollars that are spent on each patient every time they're hospitalized. And I think the stat a few years ago was right around every time a patient is readmitted to the hospital for that same illness, they're costing the healthcare industry, the healthcare system, $2,600 to $2,800 per patient. So if you can prevent that readmittance, just by screening the condition and just by the smart technology in the home, and obviously some of the other factors that come into play, you're preventing that readmittance. You're preventing that $2,800 from impacting the healthcare system. And you're talking about millions and millions and millions and millions of patients. That translates to billions and billions and billions, maybe even trillions of dollars that are spent, right? Which is impacting the healthcare system.
Absolutely.
So if you invest those billions to save trillions, I think it's a no-brainer.
Yeah, and part of that formula is being able to understand what's happening in the home, making sure that your patient is getting their groceries, they're being cared for. Did they fall down? Did they need a bath? I mean, goodness gracious, there's the when I opened this session up, and this whole series is around the digital health home. If you don't have someone in the trenches making sure that the patient is okay, all of the other technology is wonderful, but it almost starts to like not interconnect with the whole 360 degrees of looking. So that's why you're here, Debbie, because your organization has very meticulously built a blueprint that attaches itself to an existing, successful, well-known reputation community pharmacy that's in their community, and now you're adding home care to it. And it's just, so I want you to, for the listeners, kind of expand on that, and then we'll shift into technology as well. But let's just start with Happier at Home.
Okay, so I want to be able to explain how Happier at Home fits in with the technologies and everything that you as a pharmacy owner are incorporating to help that person remain in their home, optimize their health, increase their medication compliance. So if a pharmacy purchases a Happier at Home franchise, essentially it's an additional business for them. They'll have an additional stream of revenue, which is a private pay source of revenue. But where our pharmacy owners really have the advantage is that not only do you have customers that are coming into your pharmacy and relationships with hospitals, doctors' offices, transitional care, maybe different kinds of long-term care facilities. You have these relationships. So I've said this on some of our podcasts in the past. The pharmacy owner and the pharmacist are really the hub. They're where our community can find all they need in their health. So in a situation of a pharmacy owner becoming a Happier at Home in-home care provider, they're also able to keep that person independent, increase their medication compliance. The home caregivers themselves can help put on that blood pressure cuff. Some people are just not tech savvy, not that it's super technological to put a pulse oximeter on your finger and put a blood pressure cuff on your arm or stand on a scale. But having a caregiver in the home to be able to help with those things helps with the continuum. And as Ashton said, just being able to help the whole healthcare industry, that money that we would help save the industry from a healthcare readmission. If someone's discharged and they're readmitted within 30 days of being discharged, it's not the patient that absorbs that cost. It's the doctor. It's the people who provided for them. It's the hospital. So these sources of referrals are going to want to refer to you if they know you have a digital home, if you've set up digital home for your patients, if you have a happier at home caregiver in there in the home. But really, with Happier at Home, we're bridging that gap of needing that one-on-one care in the home, helping to advocate for the patient, and also having ways of increasing medication compliance from 53% to 98%. So we work well together. And really, if you think about those big box chains, they are doing this already. So we all need to jump on board and make sure that you're serving your community, those in your community and those that know you as a pharmacy owner or pharmacist. They respect you and they want to go to you, not some large company where they're just going to be another number.
Yeah, and I think it's interesting that IPC has thought about this meticulously to be able to insulate their member, their pharmacy member, which happens to be an owner of IPC, which is kind of a cool model. But you kind of saw this, Ashton, your whole team saw this, and you're like, where can we plug the holes and mitigate the risk of competition coming in and gobbling up the business of our community pharmacies? And having a network, a vendor advantage network to key and to say, cherry picking the best of the best. Who can we make sure that we're surrounding our community pharmacy with vendors who can make sure that another organization isn't going to come out and eat our lunch and take our business away? So this is part of that. So go into your vendor advantage network as well.
Yeah, I gotta say hats off to our pharmacy services and clinical programs team, which is headed up by Kelly Stovall, supported by Samantha Pomeroy, who's our director of pharmacy services, and Shannon Battle, who's our manager of pharmacy services. They're a smart group because they're going out there and they're looking for synergies in the industry with partners like Debbie and Happier at Home. Ways that we can not only leverage a value proposition to our members. So as Debbie mentioned, I mean, I think Debbie, you hit it right on the mark. When you said big box, they're already doing this, and you don't see this, especially you don't see in their, especially those that are publicly traded. You don't necessarily see the impact of these types of programs are having on, let's say, their bottom line and shareholder value. But a lot of that income that they're generating on the pharmacy side comes from these types of programs. And the model is actually not complex. It's very simple. And I just hats off to you, Debbie, for what you've been able to do, and then really focus and hone in on the independent pharmacy business, the execution model all the way to the home. And then obviously the big tie into LTC. Our vendor advantage network is, takes a look at all sorts of vendors, and we've done a great job by really streamlining how we evaluate and vet vendor partners, especially in 2025 and going forward. Debbie is one of our core partners, Happier at Home. It makes sense for our pharmacies, where we fit in terms of what we're thinking as I'd like to say we're the most innovative GPO for independent pharmacies out there today because of, the IPC Digital Health, iCare Plus brand, and the ability to kind of look at tangibles and intangibles within our pharmacy services world and our clinical programs world, and find ways to kind of bridge that gap and create kind of a two-way bi-directional value proposition for pharmacies and the community. And so here's where I'm getting at. If you take Debbie's model with Happier at Home, you still need the last mile of care. The last mile of care for us is remote patient monitoring. But you can't just implement a traditional RPM program in pharmacy today or anywhere, because we know historically it's failed. It's failed because the execution wasn't there, because the time and effort to really learn how to actually navigate and maneuver logistics wasn't there. Over the years, you have to take other people's, our predecessors' failures, and find out why they failed, internalize it, and build a better product, a better system, a better model. And then you have to kind of implement that crawl, walk, run philosophy. In health services, with independent pharmacies, that's the way we have learned to operate better. And that's what every listener, if you're an independent pharmacist, understand. That's the best formula you can possibly pursue to get to the holy grail. Take your time, take phase 1 first, and then get into that phase 2. And here's what I mean. Last mile of care. Debbie's team, and let's just take one example, and I like to use hypertension a lot because it's the easiest, right? And it's an extremely costly disease. One of the biggest elements of measuring your blood pressure is how to measure your blood pressure, right? And you need blood pressure readings to make sure that the medication is under control, that the patient's condition is under control. But you also need to factor in the physiological issues that are going on when measuring your blood pressure so you don't have inaccurate readings. Happier at Home solves that problem, right? Or part of that problem. You're there teaching the patient how to measure their blood pressure, but you're asking the key questions. What's going on today? You're asking what are the psychological issues that could be elevating your readings, and reading elevation can be mistaken, right, for a worsening condition, or reading elevation could be the best thing in the world to understand how can we help improve what's bothering you that's causing this, because that is creating wear and tear and creating your condition to worsen. That type of intervention at home is critical. The ability to measure your blood pressure properly, the ability to make sure that the cuff size is accurate especially for patients suffering from obesity, right? Happier at Home does that. So, if you think about what Debbie's doing, she's making sure that the patients are essentially taking their medications, they're set up with the devices, they're utilizing them. They're able to, understand how to, patients are able to understand how to use these devices. Their conditions they're being cared for, being triaged, personal treatment. And then what we're doing is we're getting the readings, filtering them to the pharmacy, and then creating an opportunity for the pharmacist, the clinician, or the health coach at the pharmacy to have the same type of two-way interaction with the patient, to intervene and talk to them about what's going on. So now we're talking about coordination of care. Let's see what's going on. Let me call the doctor now, because this is what I'm seeing. And now you're getting a patient who's accurately measuring their blood pressure, thanks to Debbie and her crew and the pharmacies that are engaged in Happier at Home. So you've taken a simple idea and you've closed the gap with a lot of the problems that have existed in the past from a one-to-one relationship with each patient at their home. And you've, again, repositioned the pharmacy to be able to intervene and obviously get paid for it from two sides of the equation. You have the business model with Happier at Home, and then you have the business model on the RPM side, hence IPC Digital Health, iCare Plus, the last mile of care. So that's kind of that connection there, and really hats off to that formula. So
that's a great way to put it. Yeah. And I also would like to add, our partnership for your community, we help to prevent these things from happening and to prevent the exacerbation. So if our caregivers are in the home and they notice that this person, the ankles are a little bit more swollen, or they could hear some rails or some shortness of breath, that would prompt us to be able to connect that person to the monitoring devices. So as to prevent them hopping back into the emergency department and having hospital stay. So being able to ward off that maybe congestive heart failure that they're going through, that they are just approaching into before it turns into a full-blown, requirement for hospitalization or even a death.
Timely interventions are critical.
Yes.
And that's such a great point. They don't realize that, they're a little, I just came off the plane 2 days ago with my daughter, and for example, my ankles, my legs are swollen. Here is a representative, a caregiver at the home, suspecting maybe it's not just the pressure, from the plane, maybe it's something more related to your condition. Let me help intervene and be aggressive, tackle this at the beginning of the issue, than be passive. So we can get out of that passive nature that has impacted our healthcare system for so many years and has cost us an obscene amount of dollars. I think that's just critical. I think it's a great point.
Great. Thank you.
I want to make another point, Debbie, that you've told me stories, and it's some of the most simplistic things that I never thought of before. Loneliness, for goodness sakes. So sometimes these people are all by themselves. They have maybe a cat or a dog or something, and their kids live in some other state and they don't have access. And now a Happier at Home representative comes and makes sure you check on them, talks with them. That whole element of loneliness is just so hard on the mental health of people that need Happier at Home. And you did a beautiful story about that one time at another pharmacy conference that we were at together. But just talk to our pharmacy owners about that.
Well, people need the social connection to survive and to thrive. So it's not even as simple as saying they're just going to be a little lonely. It actually has significant impacts on their health, on their mental health and their physical health. We, in our limbic system, we need those social connections. We need to be able to talk to people, maybe use our life, our lessons that we learned in life and our experiences, and talk to the caregivers about what we've done with our life. It increases their self-worth to be able to share those things with other people. So having the caregiver in there, and especially with our model, we want the same caregiver in the home all the time. So it's not as though you have someone different that you need to get to know every time someone comes in their home. So it's really important. So the physical aspect of it, helping to remind them to take medications, helping them perhaps bathing with their hygiene, making sure their nutrition is good. Those types of things are really important. Going to doctor's appointments with them, transporting them places, taking them out to lunch sometimes, but really connecting with them and having the conversations. Our patients anticipate and wait for the caregivers to come. And that's the way I want it to be. So that caregiver can anticipate what the person's needs are going to be. They could pick up on a little change in the health too. If they're a little bit lethargic or something like that, it's a really important thing. And, I hope that also we're going to talk about the cross referrals. If you own a Happier at Home, if you do expand into Eye Care Plus and LTC at home as well.
It's awesome.
Todd, the one thing that was coming to my mind, and I know that we're going to record another session down the road, but I think the industry needs to understand that when you have great organizations like IPC and Happier at Home, and then of course Best Buy Health.
Yep.
If you think about it, and you really ask us, what's the point of you guys potentially all collaborating? Now, we're obviously already partners with Happier at Home, and we're looking at forging a potential partnership with BB Health. You think about it, Geek Squad sets up the equipment, Healthier at Home takes care of the patient at home,
Yep.
and Eye Care Plus intervenes with the patient's condition on a regular basis. From a RPM standpoint, the last mile of care. What better formula can you ask for?
For patient success and for your business success. You're capturing all these streams of revenue.
I absolutely love it. I love of insulating our independent community pharmacies with technology, with programs, with partnerships that all fits in to where the future of home care is going. And the digital health home is the future. I mean, that, and it's not even debatable anymore. This is happening. $24 billion to $62 billion in about 4 years. I want independent community pharmacies to get some of that revenue. And I want them to be the experts in knowing I'm the center, I'm the hub of healthcare. And now I have organizations surrounding me ready to become the Lego pieces to really build something that is giving extreme value to our communities that desperately need it.
Agreed.
Absolutely. Well,
Well said, Todd. Well said.
We have another episode of the Digital Health Home coming soon. I want to give a shout out to Brian Urban. He's the Population Health Director at Best Buy Health. We missed you today, but he has much more important things happening right now in his personal life, and we'll keep it's a very happy thing. It's a positive thing. So I'm going to keep it under wraps until the next episode of TWIRx, where we talk about the digital health home. Debbie, promise to be back because you're our favorite home care director and coach. Make sure
I love it. I promise you, Todd. Of course.
Awesome. And Ashton, I love these conversations. I love the intelligence of your group. I just want to thank you for being part of this.
Appreciate it, Todd. And great to meet you, Debbie.
Great to meet you too, Ashton.
All right. Stay tuned. This Week in Pharmacy, we thank you so much for everything that you do as a pharmacy owner. Technician, shout you out too. And we'll be right back.